You will never have a proper ethical world where people will abandon their own people to come to give us drugs, medicine, vaccines. We still have only 3% of our people being, vaccinated, when the rest of the world, they have, more than 1.5 billion vaccines and use, which could have helped us to make a difference. So the lesson learned is very clear.
Thank you for joining us on the HSS podcast with me, Lenias Hwenda, where we talk to leaders and change makers who are transforming healthcare in Africa. This is the Titans of Industry podcast series, in which we're talking to the leaders who are shaping the African pharmaceutical and vaccine manufacturing industry about their work, the challenges and the opportunities of making medicines and vaccines, as well as other medical products on the African continent. Join me as I continue my conversation with Michel Sidibe on the ratification of the African Medicines Agency and what that means for the African continent. AMER is going to be the second health agency of the African Union, the first one being the African Center for Disease Control, which has done a great and amazing job in leading Africa's response to the COVID-19 pandemic. Can you give us some insights on how the two agencies are going to work and relate to one another in their respective mandates?
I think it's very important what you're talking about. What we need to avoid in the debate we are having today is to duplicate structures. What we need is to really make sure that we have a proper complementary between different structures, and we are working together to define that already. So like I said, you have a free trade also treaty. You need to be able to think about all those things. It cannot be done in just a very non-strategic way. But what I can say is that CDC has been doing excellent job. And what we need to do is to make sure that in parallel to the ratification process, it is a real opportunity for us today to step back and articulate, clearly our vision, and make sure that this vision could be organized around thematics which will not contradict what already CDC is doing. So for me, it's very important that we work together, that we include all those existing structure. It could be, already the whole work which has been done by Nepal with AMREF. So different structure which are existing, the communities. So we need to have inclusive approach when we talk about regulation.
Absolutely, absolutely, because AMER is going to be representing all of the 54 countries that we have. So it would be very important to have everyone aligned and agreeing on how things must be done. But to realize that vision, we will need money. We will need a lot of money to make sure that the agency is well funded to be able to perform the roles, the respective roles that member states will decide they want to delegate to the African Medicines Agency. So have you already been having conversations about what mechanisms for financing AMER to make sure that it is sustainable, it is resilient, and it is capacitated to do what it needs to do?
I think your question is a very important one. You cannot have an African Medicine Agency which will be really working and being effective and independent without looking on these very important issues of financing. Because for me, if we want to sustain our gain, if we want to be able to demonstrate that it will be a tool which will take a strong decision, we need to think about the mechanism which will help us to mobilize the funding. I don't think we should be just running from outside and trying to just make sure that all our financial, activities will be, all our activities will be financed by external funds. I think AMA can really learn from European Medicine Agency, can learn from different orders mechanisms which are existing, and also think about the fees. If you look at all those drugs which are coming in our continent, all those activities which are being done in terms of checking existing medicine, vaccine, in order to validate them, in order, I think we can have enough resources which could be collected from small fees on all those things, which can help us at least to have resources. But more than that one, I think we can also be innovative by bringing all the key independent partners, philanthropists of the continent to come around the table and to start thinking about a new replenishment system for making sure that AMA can get enough resources to operate. And I think we need to first look on a strategy, financing strategy. That is the sense of your question. Saying that one, we need a partnership. We need to build bridge. We have been already starting talking to European Union, different constituencies, US, China, different private sector and other, to see how we can really learn from their experience, how we can get also seed the money for establishing the whole structure, the sum of, I can say non-recurrent costs, which are needed to just do something and then establish the organization. But my vision, honestly, I'm sure is the vision also of the leaders of this continent, is to be less dependent from external resources, is to be able to generate more resources from our own continent, which will help us to really talk, with confidence about what we will do. Look at what was happening with AstraZeneca and others. We could not have any decision about it. People decided that AstraZeneca is not good, that they don't want to take it anymore. But at the same time, we were following the decision without having an independent body who can really say, no, sorry, we tested, we have this vision. So series of things make you dependent. And when we talk about drugs, we need to be less dependent.
Yes.
Also is important because if we have a strong regulatory body, we can also attract different investors. That's what happened in India. That's what happened in China. So I remember being there, 25, they were a net importer of medicine. So, and they become, net exporter. So I think for me, how you protect, how you have a strong regulatory body, how you make sure that the product you are producing is a quality and it can compete and the price can go down progressively because you have a number. When we talk about ECOWAS only, for example, you have 380 million people. When we talk about Africa, we are talking about 1.3 billion. So I think for me, those are scale which we need to be able to leverage.
Absolutely. But Honorable Minister, do you see African governments being able to commit? Because part of that independence, right, will require that our governments commit to buying local, buying African. We have this industry that is developing right now. We have been having many conversations with manufacturers who are involved in setting up manufacturing operations for vaccines from Cape Town to Casablanca in Morocco. And the one thing that they are all asking for is that we need commitment. If our governments on the African continent cannot commit to buying products produced on the African continent, we will see an implosion of the business models for manufacturing vaccines, pharmaceuticals, medical products on the continent. Do you get a sense that we will have that commitment from governments, because that is really needed to make this industry succeed?
Yes, I personally feel that what is very important is to learn from our past experience. But what we should avoid is that each country starting, to produce their own vaccine, starting putting their manufacturing, drug manufacturing units and others, and then it become, produced for a small group of people, and the scale is not there, and then the costs become, and the problem of quality, and the problem of competition with the price of medicine coming from different parts of the world become complicated. But if we have a hub of excellence, if we have, comparative advantage of this country and this other country, and establish manufacturing in function of a strategic approach which will help us to buy our own drugs. Because let me tell you something. The medicine just market last year was $1,400 billion. $1,400 billion. And Africa represents 0.7% of that big market. So we have a space, people, and the fastest growing market for medicine is the African continent today. So I don't say that we need to wait again to say that, okay, we each of us need to produce, but we need to be strategic and to say, okay, we will have a port of excellencies, and that will produce, by the way, take a good example. Almost with a 53 drugs we can control almost 90% of common disease in our continent. Common disease. But those 53 drugs are not produced in our continent. So, and they are not under patent. So we can start already, and we are buying them. And unfortunately, most of them are part of fake medicine, substandard drugs, making our young people, particularly children under 5, exposed to wrong drug, malarial wrong medicine. So I think it's very important for us to pay attention to that. I am convinced that market is there. I'm convinced that knowledge is starting to be established. I'm convinced that the interest of most of the partners is to really invest in the continent and build those bridges and transfer knowledge. I'm convinced that it will be great for win-win approach for all of us.
And we are seeing that I think that interest, that realization that there are investment opportunities in Africa, that partners and private sector can really come and work with local industry and local governments to take this agenda that you are working on with colleagues at the African Union, the new public health order, which includes Africa being self-reliant for the majority of its needs and not being so dependent. So you mentioned that we can learn from India and China because they also started where practically similar to where we are, and they had to build themselves up to get to where they are at the moment. And it took India about 30 years to mature their regulatory environment, to mature enough for them to start making vaccines at standards that were acceptable at an international level. For Africa, we have been dealing with a very different situation with the pandemic, which has really put our, the feet of our leaders to the fire. Like, you have to move fast. Do you think it would take us as long as it did India and China, about 30 years, to reach that level of maturity, or do you see this being a much faster process for Africa?
By nature, I am a result-oriented person. So I always think that is important to quicken pace of actions, because today we are not like 30 years back. Technology made a tremendous progress. We are talking about biotech today. We saw a vaccine which were taking us 15 years to be produced. I was pushing for AIDS vaccine in order. We never managed to have an effective. We are seeing that with the COVID, it took us 1 year and 1 year and a half for maximum to produce those vaccines. So I am convinced that the biotech is taking us to a different level. But it means that Africa needs to also Africanize research and development. Africa needs to create a platform for attracting the best of the young African who are abroad, and also attracting others' minds who are ready to come to work with us, even if they are not African, but who have the competencies which can help us to really jump and not wait to pass through the whole step those countries went through, but to really make sure that with their competencies, they know how we can be. So that's why I think it's good also, because of this AMA can identify those areas where we need a knowledge, economy, where we need to invest to make sure that we leverage this intellectual infrastructure, which is a key for making the difference in the future. So I'm not convinced at all that we will go through the same passage of India and China to reach where we want to be. We need just to be knowing that we have potential, we have resources, we have people who are competent, but we need to motivate them, we need to attract them, and we need to create space for them, and we can surprise the rest of the world and also our population.
Absolutely. I mean, we do have plenty of opportunities to leapfrog all of the technological developments that have happened. So indeed, our path may not necessarily take as long for us to reach that level of maturity. You mentioned, of course, the need to incentivize, to attract talent. That requires money. And we in Africa, our governments, we have been chronically challenged, underfunded in our health systems. How do we get the additional resources that our government seems to have struggled to bring forth for the health sector, which of course have made our economies extremely fragile, because every time we have a crisis, we erase all of the economic and development progress that we've had, a couple of decades easily. So how are we thinking? You're speaking to the heads of state. This is your daily business. How are our governments thinking about finding those additional resources that will allow us to put more resources towards health to secure African economies?
No, I think your point is a very important one. First, we need to understand that you will never have a sustain your development with unhealthy people. We realize already that with Ebola, I remember visiting countries those days. Before Ebola, they were having economic growth of almost 14%. And after Ebola, they were negative. So it's showing the impact of health crisis on all our system. If you read I think it's 3 weeks ago, the economists were doing a very good article on the fact that we have not been able to vaccinate Africa at the same, rhythm or pace than the rest of the world, the impact on our economic growth. So I think the loss for our GDP and others. So it's clear that today I'm convinced that more and more people, political leaders, are understanding that health is not anymore a cost, an expenditure, that health is an investment. And so we should put more resources. And we thought about that already in 2001, when in Abuja, we asked for 15% of state budget for health, because we knew those days already with the experience of HIV and others, that the risk is to find ourselves in a situation where we will not be able to respond in an independent way, and that we will be obliged to wait always to have resources coming from other places to deal with our problem. So I think I am convinced that this paradigm is shifting. People are seeing more and more health as an investment, and they are seeing that in a broader sense. They are not seeing that just from a hospital point of view. They are seeing that as important integrated element of their development agenda. So I will say that I'm positive, and I want to really say thanks to you for this excellent exchange. Is for me wonderful to have that discussion with you, and you raise so many important issues. The key ending word I wanted to add to what we have been having as an excellent interaction. I'm seeing a great opportunity. I'm seeing this crisis not being just a problem for us, but it is an opportunity to understand that you will never have a proper redistribution of opportunities. You will never have a proper ethical world where people will abandon their own people to come to give us drugs, medicine, vaccines. We still have only 3% of our people being, vaccinated, when the rest of the world, they have, more than 1.5 billion vaccines and use, which could have helped us to make a difference. So the lesson learned is very clear. Let us establish quickly our mechanism, a continental mechanism to protect our people, to make sure that we can have a safe medicine, to make sure that we can produce our local medicine and vaccine, and to make sure that we will attract the best mind and to Africanize research and development.
Wonderful. That's a perfect place to stop. A healthy population is the foundation of sustainable development. Honorable Minister Michel Sidibe, the African Union Special Envoy to the African Medicines Agency. It's a pleasure to have you on the HSS podcast today. Thank you so much.
Thank you very much. And let us discuss soon when the agency will be running and functional.
Wonderful. It will be a pleasure to have you back. Please do come back. If you support our work, please do subscribe, like, and share our podcast. We'd also love to hear from you. So do please send in your comments and your feedback on some of the things that you'd like to hear us discuss on this podcast. Thank you for watching.